Hi everyone. Today we are going to start with another topic, that is human health and diseases. So what we are going to study about is the human health, all the vitamins or the minerals that are required to keep us healthy. Healthy means in a state of overall health, alright, free from diseases, fit, all that covers healthy. What are diseases? How are they transmitted? What are the various types of diseases around us? How do we safeguard ourselves from them? What are the types of diseases? uh, what are the safety measures we take? What all vitamins do we need to take? All that we will study. So let's start. Now, what is health? So health is a state of complete physical and mental and social well-being. All right, so I should be healthy means I should be well physically. All my body parts, all my organs should be working well. My mental health should be well. All right, I should not be depressed, I should not be stressed. That all constitutes in good health. Socially means I should have a good social circle, I should have good friends, right? A social well-being of a person. Okay, so physical, mental and social. Physical, mental, social. Okay, these constitute health, rather than just being defined as being as free from any diseases or of physical fitness. So we are not just saying that we are free from any disease or just physically fit. We are considering the physical, mental and social well-being. All right, so if we have all three, we are healthy. Okay, you can see over here, health constitutes a lot of things. Family and friends, that refers to your social circle. Exercise, that will help in your physical fitness. Food and diet, if I have a good diet, my body would be well. Stress management, so that I am mentally well. And sleep, if I have good rest, my body would be healthy. If you do all these five, you have a good healthy body, you are healthy. Okay, healthy. Now let's come to a important topic. What are diseases? Okay, so what are diseases? A disease is a state of improper functioning. Improper functioning means something that is not properly working, all right, or any sort of condition that interferes with the normal functioning of mind or the body. So any problem, all right, any improper functioning or any condition that arises which leads me to interfere with the normal working of my body, the normal functioning of my mind and my body. So if something is interfering with my day, something is interfering with how my body works, how my body is functioning, all my organs, if something is interfering with that, then most probably it is a disease. It is shown by various signs or symptoms. Now if I have a disease, it will be shown by various signs and symptoms. Okay, so what are those signs and symptoms? Let's start. Organisms that can cause these diseases are also called pathogens. We will come to those signs and systems and various diseases in detail later. First, understand what are diseases, how are they happening. What is the study of diseases called? It is called epidemiology. Okay, when we say there is a disease spreading on a large scale, it is called a epidemic. Okay, so for example, there was chikungunya as an epidemic, right? On large scale that disease was being spread. Now what organisms cause diseases? Called pathogens. All right, pathogens. In the chapter that microorganisms, right, if you remember, we studied what are the various microorganisms, can they cause diseases. So pathogens are mostly microorganisms that cause diseases in us humans, all right, and in animals, in plants as well. So but we are talking about human health. So in humans, We call them pathogens, the things that cause us diseases, the organisms that cause us diseases. Study of these diseases is again called epidemiology. Most of the diseases are caused by microorganisms like these. These are microorganisms. They cause us diseases, a lot of diseases, right? Communicable diseases. Now we come to the types of diseases. Okay, so there are broadly two types of diseases, that are communicable and non-communicable. Now what are these? Communicable diseases, these are diseases that can spread from one person to another through various means. So a transmittable disease, a spreadable disease, from me to another person, this type of disease can spread easily, okay, through various means. Now means a transport, all right. So if I have a particular disease, it can be communicated to another person through various means of transport. So for example, they are caused by pathogens such as viruses, bacteria, protozoa and fungi. So these four are communicable. So if I have a viral disease, if I have a virus, it will be able to spread to another person. If I have a bacterial disease, I can spread it. A protozoa disease, it can spread, and a fungi disease. So what happens is, for example, if I am talking to a person, I am sick and I am talking to a friend, alright. So if I sneeze, or even when I am talking, water droplets are coming out of my mouth, right? And these contains those microorganisms, okay, and this is how they can spread through touch, right, through mouth, through various, through hanging out together, through the same food, okay, these can spread. So these are the various types of microorganisms that cause communicable diseases. Communicable means communicate, all right, to another person. This can easily spread. Non-communicable diseases. Now what are non-communicable diseases? These diseases are not caused by pathogens. They are not caused by pathogens. Okay, so communicable are caused by pathogens. Non-communicable, not by pathogens. Okay, these diseases are not caused by pathogens and cannot be transmitted from one person to another. Alright, so these diseases, they arise out of a different condition and they cannot spread from one person to another. So if I am sitting with a person having a non-communicable disease, I will not get that disease. Alright, we should know what are the communicable diseases and what are the non-communicable diseases. Okay, how do they come up? So non-communicable diseases are often related to the lifestyle. So how these diseases, they come up because of certain lifestyle conditions. So if a person smokes a lot, if a person eats very unhealthy, he might develop a certain disease that is not communicable to others. Some other factors like genetics or environmental factors, right? We will study about examples of all of these diseases, right? Let's start. Now communicable diseases, you can see over here, communicable diseases are transported through hand touch. If this person has microorganism, it will be transported to here, okay. If this person is sick, he can transmit that disease, he can communicate that disease to you, okay. See over here, this is called exchange of germs, right? That is why if you remember in COVID-19, what happened was people started social distancing, right? Physical distancing. Why did this? So that they are not able to communicate the disease from one person to another. We were wearing masks, we were wearing protective shields, right? So that, because it was a communicable disease, so that people are not able to get that disease. Now communicable diseases in India, we have typhoid, we have hepatitis, we have various malaria, we have tuberculosis, we have jaundice, we have COVID-19. These are some examples of communicable diseases in India. Communicable means they can be spread from one person to another. We were practicing physical and social distancing so that there is no contact. If there is no contact, the communicable disease will not spread. If no contact, right? What are non-communicable diseases? See, cardiovascular disease. If someone has a condition of the heart, that is not a communicable disease, right? It is a non-communicable, but it is a disease. Okay, diabetes, it is a non-communicable disease. Chronic respiratory diseases. So, for example, if someone has asthma, right? If someone has an asthma, he will not be able to send that or communicate that asthma to you. Cancer and all these things. These are the non-communicable diseases, heart related, lung related, blood related. Okay, diabetes, all these are non-communicable diseases. Now, we will define the various types of non-communicable diseases depending on the microorganism that they spread and also with examples. So, for the diseases, how they are caused, what virus causes them, okay, how are they treated, we will all study in detail. So, for the communicable diseases, the first disease is viral disease. Okay, so viral means from a virus. These diseases are caused by viruses and can be spread through direct contact, contaminated surfaces, or through the air. So, virus spreads through direct contact. If I shake hands, if I touch that person having a viral disease, I can get it. Contaminated surfaces. So, for example, in his room, okay, if I touch things, that microorganism will be able to get inside me and infect me as well. So, contaminated surfaces, those surfaces that have viruses on them, or through the air. If the person sneezes, if a person shouts, or if he's talking, the microorganisms are released from his mouth into the air. Alright, they are suspended in the air and a person can get infected. Examples include common cold. Now, what is common cold? Okay, the common cold that we get during winters, right? The sneezing, the cold. Influenza is a virus. Measles, mumps, these are diseases. And HIV AIDS. HIV is the virus that causes AIDS. AIDS is the disease, HIV is the virus. Okay, we will study about it. Measles, mumps, influenza, common cold, these are all examples of diseases by viruses. The second one that we come to is the bacterial disease. Now, what are bacterial diseases? Bacterial infections occur when harmful bacteria, okay, not the good bacteria. If you remember, we studied about good bacteria and bad bacteria. So, a harmful bacteria that can invade the body, okay, they can be transmitted through direct contact. All of these will be able to be transmitted by direct contact. Contaminated food or water. Contaminated means infected. Infected by what? The disease we are studying about, the type of disease, okay, or insect bites. Examples include tuberculosis, that is TB, cholera, typhoid fever, and strep throat. So, these are the examples of diseases caused by bacteria, right? Bacterial infections occur when harmful bacteria invade the body. They can be transmitted through direct contact. Direct contact like touching, being in contact, sneezing, contaminated food or water. Okay, the contaminated food or water. So, for example, if I have spoiled food, okay, spoiled by the bacteria, okay, if there is bacteria in the water, that harmful bacteria, if I take contaminated water, okay, dirty water, if I consume contaminated food, or in some insect bites as well, they cause bacterial diseases, right? These are the examples. Always remember tuberculosis, cholera, typhoid, strep throat. Now we come to the third one, protozoan diseases. So what are protozoan diseases? Protozoa is again a microorganism. We studied about it. It is a single celled organism. Always remember, it is single celled. It can move. It has animal like features. They can cause various diseases. Protozoa causes various diseases. Most probably those will be parasitic in nature. Alright, will be transmitted through a parasite like a mosquito or an insect. They are usually transmitted through contaminated water or insects. So if an insect has protozoa and he bites us, we get that protozoa. Okay, contaminated water, protozoas are found in water as well. Okay, contaminated water, dirty water. Okay, examples include malaria. Malaria, we all know malaria is caused by mosquitoes. Okay, amoebic dysentery. Amoebic dysentery is also a disease caused by the protozoa, and sleeping sickness. These three are examples of diseases caused by protozoa. So I will show you the pictures of all of these. So first of all, we get to the viral diseases. Viral diseases, see over here, respiratory viral infections. We have some examples. Seasonal influenza. During the rainy season, during the cold season, we get a seasonal cold and influenza. Okay, so it depends from season to season. Respiratory virus, the virus. Okay, so how do viruses work? Viruses have a thick coating, outer coat, thick coating, which protects the virus from weather conditions, heat, cold, wind, all of these things. Okay, if it does not have a favorable environment, there will be a big coating. As soon as it goes inside our system or any organism, this outer coating will break and he will start to reproduce, and this will infect us, we call it the host. We are the host. Okay, now what is HIV? HIV is a virus. Remember the name, human immunodeficiency virus. Okay, HIV, human immunodeficiency virus. Immunodeficiency means lack of immunity. What does that mean? What does lack of immunity mean? Immunity is what helps us fight diseases, fight microorganisms. So on a daily basis, we come in contact with a lot of bacteria, with a lot of microorganisms, but not everything can infect us. Why? Because of white blood cells. Because of our immunity. If we have good amount of white blood cells, they will be able to fight off infection, fight off the microorganism, and we will stay healthy. Okay. Human immunodeficiency virus is a virus that attacks cells that help the body fight infection. Okay. We attack the cells that causes infection. Okay. There is no cure, but it is treatable with medicine. Now in this virus, it will attack the cells that are making us immune. It will attack the white blood cells and it will decrease a lot. The amount of white blood cells in your body will decrease a lot. Okay, and there is no cure for it. There is no cure. There is no medicine. Okay, there is no cure means to 100% cure it, but it is treatable with medicine. We can lower the effects. We can help the body increase immunity. Okay, naturally, but there is no cure to it. Okay, HIV causes the disease AIDS, AIDS. It is a non-communicable disease. See over here, another example of viral disease is cold, common cold. It is a viral disease. Have you ever seen that during cold months, everyone in your classroom will be sneezing, coughing? Alright, that means it is a viral disease. Viral means it is transmitted to a lot of people through a virus. Okay, you can understand now that how fast it communicates, how fast it spreads, right? So a common cold is also an example of a viral disease. Secondly, we had bacterial diseases. Now what are bacterial diseases? Bacterial diseases like tuberculosis, cholera, typhoid, right? Now, what are these? So tuberculosis will be in your lungs. It will infect your lungs and it can transmit from one person to another. See over here, this person was speaking, he has typhoid. This person is breathing in the air, close air. Okay. Now, the water droplets inside the air which had his infection, which had the bacteria, will be transmitted to this. The bacteria will reproduce, he will also be infected. Cholera. Now, what happens in cholera? Okay, if you drink contaminated water, the dirty water. Okay, why do we say boil water, drink clean water? Why? Because it contains microorganisms which causes diseases. Eating contaminated food, contact with feces, vomit, or things that have been contaminated with the feces or vomit of someone who has cholera. So what happens is this will spread through your waste. Alright, if you get in contact with someone's vomit, alright, who had cholera, there are chances that will be able to transmit to you. Okay, if you come in contact with any waste product of that person, okay, you will get cholera. Contact with someone who has died from cholera. So even if a dead body who had cholera, if you come in contact with that body, you will able to get cholera. Okay, symptoms are very severe diarrhea, your stomach will pain like hell. Okay, loose motions, vomiting, leg cramps, feeling weak. This happens in cholera. It is a bacterial disease. Treatment: we take oral rehydration solution because the water content in the body falls so low. We take ORS. ORS is oral rehydration solution. This will immediately give you a lot of hydration, get your body hydrated, means a lot of water. Okay, this is used in when you are getting treated for cholera. Now I come to typhoid fever. What is typhoid fever? So typhoid is another bacterial infection and you can see the symptoms over here. Headache, pain in the abdomen, your stomach. Mostly in bacterial infections, the stomach or the gut, it hurts a lot. Okay, loose motions are common, vomiting is common, irregular fever, you get a lot of fever. Okay, weakness, we get muscle pain, we get loss of appetite, we do not feel hungry, we get vomiting, we get nauseous, right? These are again symptoms of something transported by bacterial disease. Okay, bacterial. Now we come to protozoan disease. I'll give you a good example of malaria. Okay, so this is a mosquito, everyone can see. Okay, he lands on some human, he sucks his blood. Now what happens is when he sucks the blood, he also releases a few microorganisms into the bloodstream, okay, which are protozoa. These protozoa will infect the person. We get infected blood cells. So see over here, these protozoa are infecting the blood cells and they look like this now. It will infect the liver, infected body parts, right? Infected body parts, which makes us infected, which makes us catch diseases, right? So protozoa are mostly transported by insects. Parasites, insects, contaminated water, dirty water, amoebic dysentery. Amoebic dysentery, again it will affect your digestive system, the gut region, and you will get a lot of pain over here, a lot of pain during when you go to the washroom. Okay, during removing the waste products, you will get a lot of pain. So that is amoebic dysentery. This is also due to protozoa. Another type of communicable disease would be fungal disease. Now fungus also causes a lot of disease in us humans. Okay, Fungal diseases, fungal infections can infect different parts of the body and are commonly found in warm and humid environments. Okay, it is found in warm and humid environments. They can be transmitted through direct contact or exposure to contaminated surfaces. So again, direct contact, the prime in communicable diseases, and contaminated surfaces. Examples include ringworm, athlete's foot, and thrush. So I will tell you about it in detail. Now, fungus will spread in a warm and humid environment. Warm means good temperature, and humid means moisture. Okay, so if one of your body parts or something will stay moist, okay, from a lot of time, so maybe sweat, okay, maybe during monsoon, okay, and you stay in a humid environment, you stay in a hot environment, there are a lot of chances that fungal infections in the air will infect that body part. Okay, now let me show you a picture. This is ringworm. This is a image of infection by ringworm, which is a fungus. This is how it looks. Okay, this is the fungus and it is infecting this part. This is athlete's foot. If you see, he has a lot of fungal infection inside his feet. How? Maybe due to a very sweaty work environment and keeping a shoe closed. Okay, keeping the shoe closed, having socks all day long in a humid and warm environment, this can cause fungus to spread. Alright, that is why they say that wear clean socks, wear clean shoes, aerate your feet time to time, put them in air, dry your feet, okay, because fungus can spread. Now we come to another type of sexually communicable disease. It is sexually transmitted bacterial diseases. Now, what are sexually transmitted diseases? These are transmitted through sexual contact, alright, between male and female. These diseases will be able to spread, okay, through contact, not by just touching or sneezing or direct contact, but through only sexual contact. Okay, so some examples of these diseases are gonorrhea, syphilis, and chlamydia. Alright, remember the names. These are STDs, sexually transmitted diseases. Now, these are bacterial in nature, and so for example, if a person having a sexually transmitted disease has sexual contact with another person, alright, he or she will be able to transmit that disease to the other person, and this is how these spread, right? So sexually transmitted diseases can spread through sexual contact. Insect vectors. What are insect vectors? Diseases that are transmitted through insects. Okay, insects can act as carriers of diseases. So for example, certain diseases are transmitted to humans through the bites of infected insects, right? Just before I showed you a mosquito bite, right? Mosquito bite, it is an insect vector because this disease is being transported by insects. So for example, malaria again. Malaria is transported by the Anopheles mosquito. So the Anopheles mosquito causes malaria. Dengue fever is caused by Aedes mosquito. Okay, the Aedes mosquito by dengue. And Lyme disease by ticks. Ticks are also insects. Okay, ticks cause the Lyme disease in humans. So remember, malaria, Anopheles, dengue, Aedes, and Lyme by ticks. These are insect vectors. Okay, let me show you. First, let me show you about sexually transmitted diseases. These are the various sexually transmitted diseases. Syphilis, hepatitis B, HPV, gonorrhea, HIV, AIDS, right? AIDS. AIDS is sexually transmitted. It is a viral disease, right? Virus, but it is transported sexually. If a healthy person has sexual contact with someone having HIV virus, okay, someone having AIDS, it will be transported to him. Even if it's in hospitals they say if someone is injected, okay, the needle is injected into an HIV person, okay, person containing HIV, it is to be discarded off. Okay, if it by chance touches you, all right, or it pinches you, the needle, chances are you will get HIV. So the blood of HIV patients, okay, if it comes in contact with you, you will get HIV. If you get in sexual contact with them, you will get HIV. Treatment and prevention of STDs. So how do we stop these diseases, the sexually transmitted diseases? One instrument is condoms, all right. These are contraceptives. Contraceptives are what? That prevent contact during sexual contact, okay. Vaccines are available for certain infections like HPV and hepatitis B, okay. Dental dams, we have prescription to reduce the risk of HIV. We have limiting number of sexual partners. So if a person has a lot of sexual partners, there are high chances that he will get a disease. But if he has low amount of sexual partners, he will get less chance of getting a disease. Medications for bacterial infections. Practicing safe sex, practicing clean sex with less number of people, that will lead to less STDs. Okay, stop STD. Now we come to insect vectors. What were the insect vectors? So let me tell you again. Insect vectors like common mosquito vectors are Aedes. Okay, the Aedes mosquito, it looks like this. Okay, a little white on this. He causes dengue, he causes chikungunya. Alright, these mosquitoes, we should watch out for them. Anopheles causes malaria. Culex mosquito causes filaria, Japanese encephalitis. Okay, these are some diseases caused by the mosquitoes. Okay, mosquito is a very common vector because it sucks on the blood, right? It is a parasite. It contains protozoa and can easily infect humans. Okay, another are sand flies. These are ticks. These are midges. These are mosquitoes. Okay, they will come in contact with animals, they will suck the blood of animals and also of humans and again of animals. So if there is a disease in an animal, it can spread to us humans as well. So this is why mosquitoes and insect vectors are very harmful. Okay, vectors can carry diseases that can affect both animals and humans. Such diseases are called vector-borne disease. Vector means a transmitter. He will transport the disease. Now we come to the treatments. Now what are the treatments of these various diseases that we studied about, right? Treatment of a communicable disease. Treatment of a communicable disease may involve the use of medication, right? We take medicine so that our bodies produce we use antibiotics or antiviral drugs so that our body produces antibodies, our immunity increases and we fight that infection depending on the specific disease. So every disease has its own medications. Prevention strategies include vaccination. So if I am vaccinated to a disease at a childhood, there are very less chances that I will develop that disease later on in life. Okay. Practicing good hygiene. If I keep my body clean, if I keep it dry, if I keep it hygienic, okay, if I have a good diet, I eat clean, I drink clean water and I keep my body clean, then most of the communicable diseases will not be able to infect me. Using insect repellents, I use insect repellents so that there are no mosquito bites, there are no tick bites, there are nothing, and avoiding contact with infected individuals. So if I am not in contact with an infected individual, I will not get a communicable disease, right? Infectious diseases. Now what are infectious diseases? Ways to avoid ever getting sick, okay, with a microbe, right? So if I stay away, if I clean my hands often, these are preventions, okay, the prevention measures so that I don't catch it at all. Okay, I get vaccine, I wash my hands, I eat right, I use personal hygiene, I consume vitamins. Now I come to treatment. Now what are the treatments? Treatments could be to manage the symptoms, to take medicine for the symptoms, to take medicine for antibodies. Okay, I take a good amount of rest. The doctor would advise you to take rest. Why? Because when you are resting, your body is producing antibodies. Your body will fight it. It will not focus on giving energy to movement, but only to fighting the disease. Okay, consume a lot of water, consume a lot of fluid, consume medicines, consume antibiotics, okay, like penicillin, which will help fight the infection. Now we come to the non-communicable diseases. Okay, non-communicable disease, nutritional deficiency diseases. These diseases occur due to a lack of specific nutrients in the diet. So I have developed a disease. Okay, this disease is not communicable. This will be due to a deficiency of vitamins in my body. Okay, if I don't have a particular vitamin for a longer period of time, my body will develop a disease. Okay, if that vitamin would have been present, I would have not got the diseases. So this is called deficiency. Deficiency in vitamins can lead to various health problems. Here are some examples. So various health problems like vitamin A deficiency can cause you night blindness. These are important, okay? The names of the vitamins and the diseases they cause. So vitamin A deficiency can cause night blindness and dry skin, okay? Night blindness, vitamin A. Now vitamin B12 deficiency can lead to anemia, okay? Anemia and nerve damage. Anemia and nerve damage. Anemia is spelled like this, ANAEMIA in some cases as well. Vitamin C deficiency. Vitamin C is very important for good skin, to fight off infections. Deficiency can cause scurvy. So scurvy is caused by deficiency of vitamin C. And weakened immune system. We need vitamin C for good immune system. So vitamin C, weakened immune system. Vitamin D can result in weakened bones, right? Weakened bones means vitamin D gives us good healthy bones. Now vitamin D deficiency can lead to weakened bones and increased risk of fracture. Increased risk of fracture. Okay, so now these are again, this is a table showing the various vitamins and their major deficiency disorders. So night blindness. Night blindness is by vitamin A. Okay, increased risk of mortality in children and pregnant women if they don't have vitamin A in good quantities. So little children and pregnant women. So this can cause an increased risk of mortality. Mortality means dying, the rate of dying. Okay, the children and pregnant women, the pregnant baby can, that baby can die, right? Folate. Now what is folate? Folate is vitamin B6. B6. Okay, it can cause anemia, birth defects, heart disease, strokes. These are all caused by deficiency of vitamin B6. Vitamin B12, cobalamin. Okay, the cobalamin, this can cause again anemia, right? Vitamin B deficiency, vitamin B12 deficiency causes anemia. Okay. Another example, B12, B1, you should study all these, like not in detail, but you should learn the name of the diseases that are caused. Niacin, that is vitamin B3, causes dermatitis. Dermatitis is disease of the skin, diarrhea, dementia, death, right? Vitamin C causes scurvy. If there is no vitamin C present, it causes scurvy. If vitamin D is not present, it causes rickets. Osteomalacia, osteoporosis means less bone density, lighter bones which can break, right? Break into pieces, like the bones can get fractured easily. Now, so we have studied vitamin A, we have studied all the vitamin deficiency. How do we make sure that we are not deficient in vitamins? Through a healthy diet, which will ensure that we have all the nutrition, all the vitamins. Alright, so that will be all for this lecture. I hope you enjoyed it. Thank you.